Hi, sir. How are you?
I'm doing well. How are you this morning?
I'm great, sir. Thank you for asking.
I guess it's this evening in India. I should have said this evening. How are you this evening?
Yeah, it's evening over here. So thank you so much for asking. And welcome to Love Heals Cancer and ZenOnco.io. I am Arohi from ZenOnco, and this is our cancer healing journey talk where we invite speakers who have been through cancer, either as patients or as caregivers or as survivors. These cancer healing journey talks are very close to our heart because many people have come and told us that after watching these talks, they feel inspired and they feel that if other people have beaten cancer, so can they. So thank you very much for being a part of today's Cancer Healing Journey talk. We would like to begin with a brief introduction about yourself first.
Thank you for that. My name is Steve Cobb. I live in Richmond, Virginia, United States. I was diagnosed originally with a glioblastoma on November 10th, 1990, and told to get my affairs in order. At that point, I started searching out neurosurgeons who were willing to operate because I was told it was inoperable. The seventh neurosurgeon I met with, a gentleman named Alan Friedman at Duke University in Durham, North Carolina, US, operated and found out that it was not a glioblastoma. It was an anaplastic oligodendroglioma, which is still a malignant brain tumor, but it is a lot slower growing than a glioblastoma. Statistically, I was supposed to be dead 27 years ago. Someone with this type of cancer, the survival statistic is 5 years at best versus 6 to 12 months with the glioblastoma. I'm 32 years out now. I feel better than I have felt since before I was first diagnosed. My priorities have completely shifted. A cancer diagnosis will do that. You really start recognizing the things that are truly important in life. You don't get stressed as much. You don't get anxious as much as you did beforehand. And I've come to realize that that diagnosis was probably, at this point in my life, one of the greatest blessings I've ever had.
Right. So what were the initial symptoms that you felt and after which you went to the doctor?
That's a wonderful question. For about 7 or 8 months before I had the grand mal seizure, and I had the grand mal seizure at an American football game. At American football games, they have rescue squads typically because there's such a large crowd, and I'm very, very, very thankful for that. Prior to having the grand mal seizure, I was having symptoms where actually I was beginning to think that I was losing my mind. I came to find out later that they were what's called petite seizures, where I would lose the ability to speak. I would hear things that weren't there. I have diabetes runs in my family, so I was having blood tests done by different doctors. I was convinced I had diabetes because of the fact that I'd lose the ability to speak right in the middle of a conversation. So it was actually almost a relief when I found out that I had a brain tumor, because I really did think that I was losing my mind, which in my estimation is maybe the worst thing that could ever happen to a human being is to go insane or to go crazy.
And what all treatments did you undergo?
After I found Dr. Friedman at Duke, he did surgery. He removed a tumor the size of an orange. At that point, I went into pretty much immediately, into a 8-cycle chemotherapy protocol with the drugs vincristine, which is an IV, procarbazine, which is oral, and a drug called CCNU, which made me violently ill. As a matter of fact, when I would take that pill, I would take a pillow and a blanket and set up camp in the bathroom because I knew I was going to be vomiting within about 30 to 45 minutes. And I did 8 cycles of that. The conventional wisdom was, a 3-week cycle. They would do blood work, and then there was maybe a 2 or 3 week respite between the cycles. But as I got further along into the chemotherapy, it would take longer and longer for my blood to get back into the expected range. So what was originally supposed to be maybe an 8-month, 8-cycle chemo protocol lasted a year. It lasted a full year. I've also had a relapse. This was back in the early 90s. I had a relapse where I started having seizures again in 2012 and 2013. So all of 2013, I did chemotherapy. I was taking a fairly new drug called Timidor the second time around. In April and May of 2014, I had 30 radiation treatments. And I really credit the radiation treatments. I feel like I was on death's door at that point. And I left Duke because they were unwilling to do radiation and transferred my care to a place called the Levine Cancer Institute in Charlotte, North Carolina, who were willing to do the radiation therapy. And they did this in the spring of 2014. And the radiation oncologists, really had to think long and hard about whether to go ahead and treat me with the radiation therapy. And the last thing he said to me before I started the treatments were, "We're going to do this, Reverend Cobb, but at best case, it will buy you 2 or 3 more years." Well, that was over 8 years ago now, and I'm still feeling great. I really feel a renewed sense of life. My faith has been critically important through all of this. I should have mentioned that pretty much from the start. But my level of faith has grown so much stronger through this cancer, this journey with brain cancer.
Did you try any alternative treatment as well?
That's a great question. And I did go to a homeopath back in 2007 and shared, my story with her about the cancer and everything like that. And she gave me a remedy, but the remedy was more to control the respiratory things that I would get that would weaken me so much that I was feeling like the cancer would have more of an opportunity to grab hold again if I didn't take care of myself. So she gave me a remedy more for bronchitis and pneumonia, which I would get once or twice a year. From the time I was a teenager, I would get that once or twice a year. So back in 2007, I did go to a homeopath, and she gave me a remedy that resulted in, that was 15 years ago now, and I've had bronchitis a total of twice in the last 15 years, where before I went to the homeopath, I would have probably had bronchitis at least 20 times in 15 years.
Mm-hmm. Any dietary changes, any lifestyle modifications that you made?
Oh, absolutely. I stopped eating red meat for, let me think, 18 years. I stopped eating red meat for 18 years. And I used to like to drink alcohol. And I stopped doing that for 26 years. And at this point, I started drinking beer again in 2016. So from 1990 to 2016, I had no alcoholic beverages. I actually smoked cigarettes before I was diagnosed. I put those down and I haven't picked them back up again. When I see people smoking, I don't do this every time. As a matter of fact, I guess it's become pretty rare, but I used to get pretty aggressive with those people. to the point where I'd, take off my ball cap and show them scars on my head and tell them, I used to smoke cigarettes, and you're really playing with fire doing that.
That's a great advice. And how did you manage your emotional and mental well-being during this entire process?
That is a great question, and the work that I'm doing now is all based on the cancer that I had. As soon as I survived the chemo back in the early 90s, I became a pastor in a church here in the United States. I actually pastored a church in the state of Virginia, in the state of North Carolina, and in the state of New Jersey here in the U.S. The second time, when I had the relapse in 2012 and 2013, I felt called, after I survived that, to start a ministry called Cord of Three Strands, where I'm counseling people who are going through the same thing that I went through.
And during those times in this journey, which were dark for you, those dark periods, what kept you going at that time?
Faith. That's the easiest answer of all, faith. My faith grew so much stronger. I'm a Christian. My faith grew so much stronger through this period of time. And I realized how over the course of time, I had really moved away from recognizing the presence of God in my life. So that was very powerful. As a matter of fact, that is the most powerful component of my survival, is my faith. And that's what I encourage people today. I don't work with, I have hundreds of people that I work with, and not all of them are Christian. As a matter of fact, there have been at least a handful of very angry atheists that I've worked with. And that has just been such a blessing for me, to hear their point of view, to work with them, to slowly over the years introduce faith into their lives, to see the barriers breaking down. We have here in the United States, and I'm very aware of Bollywood from my trips to India, but Hollywood here in the United States has just convinced, especially men, that, through actors like John Wayne and Clint Eastwood and Bruce Willis, that convinced men that if they ever have to ask for help from anyone, that they're weak, worthless and weak. And that couldn't be further from the truth. We are created to live in community, to seek out others who have help, or who can help us, who have gifts that perhaps we don't have. But community is so critically important, and I know you realize that.
What would you say are your top 3 learnings from this journey?
Pardon, could you repeat the question?
Yeah, sure. So what would you say are your top 3 learnings from this journey?
Well, the power of faith would definitely be number one. The importance of community is, critical also. And for the third, I would just say the importance of taking care of yourself through diet, through exercise, your emotional health, whether it be through, diet and exercise. Both of those things really go a long way towards, your mental health, your emotional health, your spiritual well-being. And of course, the fourth component is your physical health. But just to be so aware that we're not, every human being has all of those components, all 4 of those components. And as human beings, we tend at times in our life anyway, and for many people for years of their lives, just ignore 1 or 2 of those components. And you really can't do that. You have to be aware of all 4 the spiritual, which, in my estimation is the most important, but the spiritual, the mental, the emotional, and the physical well-being of yourself. You have to really focus on that, particularly after a cancer diagnosis.
What would be your message to other cancer patients and their caregivers?
My message to cancer patients would be keep your sense of humor, an optimistic outlook, which is so easy for me to say and so excruciatingly difficult in your own life to carry out. But it's so critically important. The people that I work with, almost universally, when I start working with them, are anxious, they're stressed out, they're scared to death, and they're angry. And typically the anger is focused on God. Why me? Why am I not going to be here for my daughter's wedding? Why am I not going to be here to greet my first grandson? Why am I not going to be here, depending on the age now, to graduate from law school? Why am I not going to be here, to enjoy my wife or my husband, our retirement years that we had planned to have property by a lake, to go fishing or swimming or at the beach? It's a very, very much of a life disruption. And that's probably putting it mildly, to receive a cancer diagnosis, particularly when your doctors are telling you that your prognosis is 3 to 5 years or 12 to 18 months. That is a very, very difficult thing for people to understand and to deal with and to wrap their minds around. The fact that someone is telling them that their days are numbered. It's very difficult to hear that.
And finally, if you had to sum up your entire journey in just one sentence, what would that be?
The power of faith, no matter what your faith is the most important thing for one to concentrate on when you are diagnosed with cancer. We can't do it ourselves. We have to rely on people who have been trained in the different fields. We have to rely on the energies of the human mind that have come up with the medications, that have come up with the MRI machines and the PET scans and the medications. But just to remember that all of those things are brought about by the gifts that whatever God you worship has bestowed on you, on those different people. So right off the bat, you're not in it alone. You're not in it alone. There are groups like your group. There are groups, counseling groups. There are religious people that you can go to see to help you walk through the journey. There are just so many sources of help out there. And the very worst thing to do, which is what a lot of people, their minds and their bodies are telling them to do, is to go lock yourself in a room, to get into the fetal position, and to feel sorry for yourself. We're not supposed to do that. It's negative. It's life shortening to do that, even though it is the inclination of a lot of people to just stop playing soccer if you have a regular soccer game every week, or cricket. I know cricket's big there too. But just whatever activity you enjoy, whether it's dominoes or card games or walking or just a club that you belong to. So many people, their inclination is to just become hermits. You lock yourself away, feel sorry for yourself in a dark room. What we call here in the United States, throw yourself a pity party. That's probably not a term in India, but to just feel sorry for yourself. And that is not what we're called to do. and it's so very negative. If your prognosis is 3 to 5 years and you engage in those behaviors, you're going to shorten it to 12 to 18 months, because basically what you're doing is you're committing suicide by doing that.
Absolutely. So, sir, it's been really inspiring listening to you. Thank you very much for sharing your journey with us, and wish you all the very best for all your future endeavors. Thank you very much for being here today.
Thank you very much for having me.
Okay, bye-bye.
Bye.